Today, we're going to talk about a powerful and honestly, often invisible force that shapes our health every single day: the commercial determinants of health. We're going to look past the idea of individual choice and really dig into how the private sector, everything from the food we buy to the laws that get passed, has a huge impact on our collective well being. So let's dive in. We all like to think we're in the driver's seat when it comes to our health. We choose what we eat, we choose to exercise. But is it really that simple? Is that the full story? That's the big question we're tackling. Because the truth is, a lot of those so-called choices have been designed and influenced for us, long before we even think about making them. All right, so here's our game plan. First, we'll nail down exactly what we mean by commercial determinants. Then, we'll get into the nitty-gritty of how commerce actually shapes our health. We'll look at who's most affected, weigh the bad against the good, and finally talk about what a healthier path forward looks like. Okay, let's start at the beginning. To really get a handle on this idea, we're going to start with a concept that many of you working in policy and public health will definitely know well. So, you've almost certainly heard of the social determinants of health, right? This is the big picture stuff. It's the conditions of our daily lives, our economic systems, our social norms, where we live and work. Basically, it's the foundation that our health is built on. And that brings us to our main event. Commercial determinants of health, or CEDO, aren't some separate new thing. The key thing to get is that they are a crucial piece of the social determinants puzzle. Think of it as zooming in on the specific things the private sector does and sometimes what it doesn't do that impacts our health. So how does this actually work? How does business exert so much influence on our health? Well, it turns out there are a few key pathways. Some of them are pretty obvious, but others are a lot more hidden. The most direct route, of course, is through the products themselves. I mean, think about the way unhealthy things like tobacco, sugary drinks, and ultra-processed foods are designed, priced, and aggressively marketed to us. This has a direct line to the rise of non-communicable diseases like diabetes and heart disease. And of course, young people are often the main target because they're especially susceptible to slick advertising. But it goes way beyond just the stuff we buy. Commercial activities literally shape the world around us. For example, when forests are cleared for commodities, say coffee or tobacco, it can create new breeding grounds for mosquitoes, which can increase the risk of malaria. Or think about factory pollution, which disproportionately affects poorer neighborhoods. And then there are the working conditions themselves, which can take a massive toll on both physical and mental health. Okay, now this is where things get really complex. Commercial interests can actually shape what we think we know. They do this through lobbying and political donations to water down health regulations. They can fund research that, surprise, surprise, produces results that are favorable to them. They can even create official-sounding front groups to sow confusion and doubt about things like climate change. And they can use intellectual property laws to keep life-saving medicines out of reach for people who can't afford them. So all of this influence isn't spread out evenly, not at all. And that leads to a critical question. Who is carrying the heaviest burden from all these negative impacts? And here's the absolute core of the inequity issue. The people who suffer the worst health outcomes are very often the same people who see zero economic benefit from the product or service that's causing the harm. It's a fundamental, deeply unfair imbalance. And this imbalance just makes existing problems worse. It's a domino effect. It hits income levels, it limits educational opportunities, it can create food deserts, it can even make things like gender and racial inequities stronger. We see this play out on a global stage too, where lower-income countries often face the most intense pressure from these commercial forces. But look, it would be easy to just paint the entire private sector as the villain here. But the story is more complicated than that. It's really a double-edged sword, because there is also incredible potential for business to be a powerful force for good in public health. So on the one hand, you have all the harmful actions we've been talking about. But on the flip side, companies can make different choices. They can change their products to be healthier, less salt, no trans fats. They can pay their employees a living wage and offer paid parental leave. They can work to make essential medicines more available and affordable. They can even pull their money out of industries that harm health. And the workplace itself can be a huge engine for health. And I don't just mean following the basic safety rules. I'm talking about companies that actively promote the well-being of their employees with things like healthy food options, opportunities to be active, and providing solid health information and resources. Okay, so we've laid out the problem and we've seen both sides of the coin. So now the big question is, where do we go from here? Let's shift gears from the problem to the solutions and look at policies that are actually making a real difference out in the world. 5 billion. That's a massive number, and it's how many people around the world are now covered by at least one major life-saving tobacco control measure. This is huge. It shows us that large-scale, positive change isn't just a fantasy, it's actually happening right now. And you can see governments taking real action everywhere. We've got 29 countries with total bans on tobacco ads. About 50 countries, from Chile to India, have put taxes on sugary drinks. Saudi Arabia is taxing multiple unhealthy products. And then you have places like Bulgaria, which offers incredibly generous maternity leave, which is a direct investment in the health of the next generation. But obviously, the job isn't finished. There's still a lot to do. We need to dig way deeper into how all of this affects health equity. We absolutely need better governance and more transparency to hold everyone accountable. And this is the tricky part. We have to navigate some serious conflicts of interest to build real, game-changing partnerships that put public health first. And make no mistake, this isn't some abstract academic issue anymore. The COVID-19 pandemic threw a massive spotlight on the private sector's role in our health. It's now front and center in the global conversation about the UN's Sustainable Development Goals. And that brings a whole new level of urgency to getting this right. So I'll leave you with this final question, because it's one that policymakers and researchers are grappling with every day. What's the best path forward? Is this really about waging a constant war against the private sector, or is it about being smart and figuring out how to steer that immense power and innovation toward a future where everyone has a better chance at a healthy life?